actually, I work in an open office setting, so people do not make appointments to see me. They literally walk in whenever we're not in a meeting or when someone's not occupied, so everything gets resolved very quickly. But we work collaboratively. As you see, between the CFO, the CIO, HR, our part of the 3 deputy secretaries, that's how we work. We work, actually our offices are on the same floor. They're within almost shouting distance. If someone needs something, all of a sudden everyone appears in front of them. By working collaboratively, we get the job done. We bring different talents, different information to every meeting from every division, and that's why you have already seen and felt the fact that there are improvements. You're seeing better reports, more precise report, more timely reports. You're seeing your issues resolved when you escalate them to us or request them from us. It is because we broke down the silos. The other reason why a second in charge concept that was previously in the department and in the Division of Medical Assistance didn't work is because that's what happened. You had silos, information was filtered or not advanced up, not enough correct information in the correct meeting was presented and mistakes were made, sir. So this really is the standard in industry for an organization that is an $18 billion organization.
Senator McKissick.
And this would go to Mr. McGogle. I'm just curious, sir, to what extent have you conducted research and analysis to determine what appropriate market-based salary should be for the people that you need to hire? I know you pinpoint specifically these 80 positions in the medical and allied health area, but I mean, has that research and analysis been conducted to be able to identify how much flexibility you need, and how far are we off the target in terms of what kind of compensation levels we need to pay to get the talent that we need to carry out the task and responsibility the agency is charged with?
Senator, when you look at market data, we have access to market data. OSHR has access to market data. They allow us to take a look at some of that. Folks like myself who come in from industry who have familiarity with the market, we bring that knowledge with us. As the Secretary mentioned, if you look at some of the functions in our organization that are led by people who obviously have experience in those functions, as we interview candidates, that is another excellent source of what it's going to take to bring them on board. As I mentioned earlier, the Office of State HR, which you might be aware of, is in the process of studying and putting together a new statewide compensation initiative where they'll develop new compensation ranges exactly based on what you just said. They're obviously taking the lead on that. Agencies like ourselves are involved in that project because we have boots on the ground knowledge of what it takes to bring people on board into our field, whether it be the medical, allied health, the IT organization. So it does come from a number of sources, studies, information from people that we're actually trying to hire, and then at the same time experiences of those in the organization.
Quick follow-up, Mr. Chair.
Follow-up.
And that's simply this, I mean, could you pinpoint or target identify some of those areas that are most needed and kind of give us illustrative examples of how far off we are? Because I mean, that could directly has to relate to retention, I would assume. If you can't pay people what they're worth and they go to the private sector, obviously once they get some experience, maybe they come there initially to acquire it, but they're moving on. So I mean, how far off are we?
Well, Senator, I can give you an example. I mentioned the audit organization, and to be honest, I'd be happy to provide more information because I don't have all those details in front of me today. But in the audit positions that we've had to push the envelope within OSHR, the range, and actually have to try to get higher classifications for positions and have them create new classifications for us because they haven't met what's existing right now. We've been off anywhere between 20 to 30% of salary. Just it goes to, I guess, my focal point here is, depending upon what you're looking for, the knowledge, skills, how the state wants to move ahead, you do have to get more competitive. That doesn't mean you have to be above the market, but you've got to at least get to the market. And that is a problem. And one of the things that OSHR is aware of is our positions are not yearly market-based. So the range might be 2 to 3 years old, and of course, you have inflation, you have change in demand, and if you don't keep up with it, then the range falls behind. So I know I'm going further than your answer, but there's a lot that's involved in that.
Thank you.
Mr. Chairman, if I may, Senator, we actually have people go to private industry from the department that have gotten offers twice as much as we pay them. So we are off substantially in the skill sets that are critical to the department. And Senator, also in reference to having such a high vacancy rate and turnover rate, a lot of that is historically the department has not put efforts into having enough bench strength so that people can get hired to senior leadership positions or promoted into senior leadership positions. So our efforts inside of the department are really in two ways: getting talent from the outside and yet aligning what we have inside of the department and trying to promote people to the correct position for them. It is a chronic problem and we are trying to get it right, sir.
Thank you, Madam Secretary. That's very insightful.
Representative Adel.
Thank you, Mr. Chairman. I'd like to direct my question to Mr. Goebel, if I may. I want to get a little specific. In traveling around to the psychiatric hospitals, one of the problems has been for them to staff effectively and completely. We use quite a bit of lap salaries or unfilled positions and things of that nature. What is the current update? Are we seeing some progress in those areas?
Yes, Representative, we are. Because of that medical allied health flexibility we have, which allows us to bring people into those positions at a higher level than we were able to do before. Working with OSHR, we classified those positions. The ranges in those positions are workable. But the flexibility you gave us allowed us not to be restricted to the amount of salary we could bring people in. And we still have work to do, but it has gotten better.
Senator Davis.
Thanks, Mr. Chair. I'm also directing my question to Mr. Goebel, Mark. I'm just trying to get a grasp behind turnover. It's a double-digit turnover, and I'm hearing retirement, salary, and there's one other thing. What would you attribute as the most significant understanding of double-digit turnover? Is it retirement?
No, I think it's really better opportunities. I think it's more centered around, when you look at the growing local economy in our area, especially in the Raleigh area, this goes back to the question of salaries. If we can't keep up, well, we are going to lose some people. And I would say it's more towards that. The retirements probably were more early on, but of course, you only have so many people that are retirement eligible. It really is the salary pressure now.
Chairman Heiss.
Thank you, Mr. Chairman. Madam Secretary, I think it's interesting, but I still think we're kind of seeing this in the abstract, that there's areas here. Is it your expectation that part of the governor's next submitted budget will have a new salary structure and plan for the department that would eliminate these and finally take those vacant positions not needed completely off the books? Or if not, is that something you're willing to submit to us for an overall plan for the salary schedule as we consider budget decisions?
Senator, as I mentioned in my couple of my slides, last year through the salary adjustment fund, we were able to make some impact on the salary pressure. But there is still more that we can present to you in certain areas. If a salary adjustment fund is another possibility, that's obviously an excellent avenue for us. The compensation structure, the salary ranges, we know we're working with OSHR on. So on that one, if we have a struggle, obviously we could come to you for assistance there, but really the salary adjustment fund would be very beneficial.
Senator Tar?
Thank you, Mr. Chair. If you'll indulge me, kind of a two-part question, and since we're in learning mode, this is very helpful. Since we're trying to retain, is there, in current employees, any formal initiatives around retention? And if so, and we're trying to promote within, is there any formal or informal structure around CPE?
As far as retention goes, we try to be proactive in that area, and this is something there are certain things, good questions you're asking me. We work with OSHR on some of these things, because obviously we don't have complete authority to do things outside of that. But where we know we have targeted issues, like we did on the allied medical health, you helped us. That was a focused area because we were losing people. Where we're having issues staffing the audit organization, we work with OSHR on, because if we don't address that, then bringing those people on, you're going to probably end up losing them later. So there are specific areas, functional areas that we've looked at. There's more that we need to do. But I'm very hopeful with part of this on the compensation side of it, the range side of it, that we can at least with OSHR, get that as close as possible to what we need.
Yeah, the follow-up is just the last half of that question around CPE, if you can address.
Senator, on the CPE, I don't have that information with me. I'd have to kind of get an answer back to you on that.
Any additional questions from members? Secretary Bosch?
Thank you, Mr. Chairman. We're speaking about an example of the auditors, but our needs in the department are quite diverse. And when we're speaking about a need for attorneys, for finance people, budget people, economists, people who are very good at analytics, that those skill sets are quite expensive in the open market. And we don't have an ability to even start recruiting people. So we have to ask for help from you or from the state HR in whatever way we can to even try to find some form of acceptable salary for these skill sets. Our department, as we move forward, it just needs the next step on ability of especially analytics and information technology. That's not traditional, either in state government and especially not at HHS, and that's why we struggle, because we keep sometimes positions open because we will not hire someone who's not suitable for the job that's posted, and we don't have enough money, or we don't have the authority to hire what we as we need. And we thank you very much for the last 19 months. You have been extremely receptive when we came with specific requests, whether for the forensic pathologist or other situations. So thank you. You have been very helpful, and we will continue to do that as we work with state HR.
Senator Pate?
Thank you, Mr. Chair. Madam Secretary, if we started looking at your last request there, which we certainly have to this point, but we haven't really started putting positions down like you are suggesting. My question is, what would your organizational structure look like then?
Senator, exactly they we're working right now. What you have in front of you is what we are creating, not only to meet the immediate need, but we are creating an organization structurally that is the foundation for the future, with skill sets that are required for the future, with an ability to be pliable and flexible, to be able to adjust to whatever will unfold from the federal government or from the state government. We must be flexible, we must be as nimble as we can be, and we must, in order to be reliable and fulfill our obligations, Senator. So we will do exactly the same organizational structure.
Follow-up.
Follow-up?
Thank you, Mr. Chair. Madam Secretary, thank you for that remark. Do you know of other states where the department would be, where your organization might go to match what other states, some other states are doing that you have seen?
Sir, the diversity of need of the states is huge. There is no one model or one example in the United States that everyone wants to replicate. The needs are different organizationally, based on many reasons. We do look when we are trying to create a specific model, what other states are doing, and what the federal government, where is it going, if we can see that at least any clearly, to where the federal government is going, so we can predict and try to align to that. But there is no a template in the United States in the healthcare industry or in government that's the perfect model. It's a process, it's an evolution both for the federal and state government.
Follow-up?
Just a comment, maybe North Carolina might be the model for other states to admire.
Well, sir, we are most